Hello everyone, welcome to Diagnose It. Today we'll discuss this case, and this is a 32-year-old man who presented with painful cord-like lesion on the chest wall. As you can see here, this is the cord-like lesion on the chest wall. Now firstly let me tell you the diagnosis of this case. This is called Mondor's disease, and we'll discuss about this disease under the usual headings. So firstly, starting with our what? Well, this is basically a superficial sclerosing thrombophlebitis of basically superficial veins, and these veins can be of different locations in the body. Like, it can involve the anterior chest wall, like here in this case. It can involve the penile veins, so that can be penile Mondor's disease. It can involve axillary veins. This is called as axillary web syndrome. Well, it can also involve this superficial epigastric vein, where there is a palpable cord-like structure on the inferior outer quadrant of breast. So these are different type of Mondor's disease, or different locations of Mondor's disease basically, and this is just classified on the basis of different locations where it can be present. Most of the time it is a self-limiting condition, and it gets corrected on its own after a duration of 4 to 8 weeks. It is more common in females as compared to males. And let me show you this image. If the superficial epigastric vein involved, then this there is this cord-like structure that is palpable. You can see here. And this palpable cord-like structure, this is called as Mondor's cord, and it is seen in this superficial epigastric vein when it is involved. Now let's come to why it occurs and what basically happens in this disease. Well, for the why, firstly we need to know about this Virchow's triad. And in the Virchow's triad there are three things. One is this hypercoagulable state, other is the stasis of blood, and this is the injury to vascular wall. And due to all these three things, when these three are present at a time, then this leads to the development of thrombosis. And this superficial sclerosing thrombosis of a vein, this is called as this Mondor's disease. So why these things are occurring? Firstly, let me tell you, according to the location. Like, if this is involving this superficial epigastric vein below the breast, it can be due to tight clothings, some kind of procedure done in the breast, like any kind of biopsy or some surgery, or in cases of any inflammatory condition like breast abscess or something. It is also sometimes related to cancer, but this is not like cancer is causing this Mondor's disease. Most of the time it is due to the procedures that are done during the treatment or sometime diagnosis of the cancer that leads to development of this Mondor's disease. In case of axillary web syndrome, this is most of the time due to some kind of surgery, and the surgery can be like axillary lymph node biopsy, like this sentinel lymph node biopsy that is done for this breast cancer, and can also be due to resection of this axillary lymph node. And in cases of this penile type, it can be due to this very strenuous or very excessive sexual activity or trauma. So these are basically the risk factor for development of this Mondor's disease, and these are also the part of history that should be present for this clinical diagnosis of Mondor's disease. Now let's discuss what happens. Now when the risk factors are present, so due to these risk factors, this thrombosis develops. And this thrombosis, after that there is occlusion, and for occlusion there is this fibrin that is deposited. And along with fibrins, various inflammatory cells like neutrophils and macrophages, these are also depositing. And due to this inflammation, there is this gathering of connective tissue. Connective tissue also get deposited in the vessel wall and in the vessel also. Due to this connective tissue, there is this palpable cord-like structure that is seen in this Mondor's disease. And due to all these things, it takes around 4 to 8 weeks to again recanalization of the vein. So it's not just the thrombosis, it is also deposition of connective tissue and this fibrin and inflammatory cells. So we have discussed about why and what is happening in this disease. Well, in the presentation, as you can see in this case, patient usually present with this painful cord-like structure. Okay, and along with this painful cord-like structure, there can be difficulty in the movement. There can be erythema over the chest wall. Along with this presentation, there can be some physical findings of some kind of biopsy or some kind of other procedure or surgery done. So these are basically the presentation of the patient. Now let's come to the diagnosis part. And in the diagnosis, it is basically clinical. And in the clinical diagnosis, what we need is, along with the risk factors that I have discussed, these kind of symptoms. So these symptoms along with these risk factors, this leads to this diagnosis of this Mondor's disease. If you want to do any investigation in the patient, then you can go for this USG of that vessel wall. And here we need to be a little bit cautious because association of it with the breast cancer is also seen, or some kind of procedures that are done for the breast cancer is also seen. So we can also go for this mammography or any other confirmatory test to rule out some kind of breast cancer if there is any in the patient. So this is all we need to know about this diagnosis. Now let's come to the treatment. Well, for the treatment, it is a self-limiting disease, and the drug that are used in the treatment are these NSAIDs. These are basically for the pain management of the patient. And along with NSAIDs, if a specific management is asked, then in an acute stage, we can go for this unfractionated or this low molecular weight heparin. If it is injected in the cord, then this leads to the recanalization procedure a bit faster. In some cases, this intralesional triamcinolone can also be used. This is basically a steroid and decreases the inflammation that leads to shorter duration of this disease. So this is all about the treatment part, and this is all you need to know about this Mondor's disease. If you have any question regarding this, you can ask me in the comment section below, or you can DM me on my Instagram handle at diagnoseIt. And don't forget to like and share this video and subscribe to my channel. Thank you.